Okay, it's recording. Daniel, can you hear me?
Yes.
Okay, great. So hello and welcome to the GDI Hub Talk series organized as part of the celebration of International Day of Persons with Disabilities. My name is Maryam and I'm a PhD researcher and impact fellow at GDI Hub. My PhD research explores agency and contribution of blind and partially sighted people in outdoor leisure activities. Currently, I'm exploring mobile technologies that support blind and partially sighted people in capturing and sharing of outdoor experiences with others. Today, I'm joined by my colleague, Daniel Hajaz, who manages innovation workstream at GDI Hub. Daniel, would you like to introduce yourself?
Yes, and a warm welcome to all of our audience. So as Maryam was saying, my name is Daniel. I'm coming from Hungary originally. I have been living in England for the last 8 years, where I studied physics as an undergraduate student. Then I carried on with my PhD in human-computer interaction, science, communication, and haptics. And due to my lived experience of sight loss and blindness in general, I got interested in science accessibility and in general, just disability innovation. So I'm now really privileged that for the last 5 weeks, I have been working with the Global Disability Innovation Hub. And I'm really looking forward to this conversation with you, Maria.
That's great. Daniel, would you like to tell us a little bit more about what your job entails at GDI Hub as Innovation Manager?
Absolutely. So as a background, with the GDI Hub, we essentially operate across 5 domains. So things like research, teaching, advocacy, and one of that is being innovation. So that's primarily my domain, or the domain I contribute to the most. And the other part of the job title, the management side of things, I guess is pretty descriptive. So I'm doing a little bit of everything. I'm talking to all our academic partners inside UCL and outside UCL to bring research into impact and practice. But of course, I'm looking at the more, how should I put it, the operational side of things. So, fundraising, making an ecosystem of innovation with startup founders, entrepreneurs, how to find investment into these ventures, and in general, that's kind of the broad level description of what I am going to be doing.
Yeah, that sounds really exciting. And we can talk more about that, how your work basically helps us in innovation and disability inclusion as well, because we know GDI Hub are leading disability inclusion for a fair world and in fair and inclusive world for all. In this talk series, we will be discussing themes highlighted by the UN on leadership and participation of persons with disabilities towards inclusive, accessible, and sustainable post-COVID world. And one of the themes is participation and research of disabled people in innovation and technology design, which is kind of relevant to what you and I do, Daniel. So we know also that in the news and in the literature that has been coming out based on research related to COVID-19 impact, that the crisis has highlighted the deepening inequalities and exposed the extent of exclusion that disabled people face around the world, including digital technologies for work, for education, and support for daily activities. Like a lot of people, when they couldn't go out, they had to rely on technologies to get in touch with people, to order groceries, etc. And there have been countless stories of this, disinclusion and inequality. So, Daniel, what are your thoughts on this impact of inaccessible technologies for disabled people?
Yes, well, I have to acknowledge this is a very complex question and it's very difficult. So I'll try my best to give my insights to that. And I think I would like to start with just a simple example that most of us will be able to relate to, and that's Zoom, the service we're using now to actually record this talk. So when I was still in my PhD, that's when really the pandemic started to hit most of us. And this new concept of Zoom just came up more and more often. And I was still about to do research studies with some of the user studies and participants. And one of the biggest questions and the kind of this fear or panic that started to build up in me, like, oh, what if Zoom is not accessible for me as a screen reader user? The whole world seems to be revolving now around Zoom. So, okay, well, sooner or later I had to try, and it was just such a great relief that, that particular service is accessible. So I will be able to, carry on with my just kind of day-to-day meetings with my PhD supervisor. I'll be able to, run some maybe qualitative interviews with my research participants, and that's great. But let's assume it wasn't accessible. Then who knows if I was able to finish my PhD at all, and if I didn't finish my PhD, maybe I wouldn't do this job now. And it just has like this domino effect on so many different things. And this is just my personal experience, but it applies to anybody else. I mean, there was lots of panic in the beginning about all the news going around, and families trying to connect across countries, and suddenly we couldn't really visit each other so often, so everybody had to rely on different technologies, including elderly people, disabled people, people maybe with all kinds of special needs, and if the accessibility is not there, if you don't include absolutely everybody's needs, then well, as I said, then it's a domino effect, because first you maybe just won't be able to get your shopping in, but then that will have an impact on your physical health for the few months, because you don't necessarily get the nutrition you want. Maybe you don't have other access to other services, and then slowly it goes down all the way to like your mental health. You'll start feeling isolated if you, for example, had the habit of just meeting people in the park. Either they came to you or you went to them. And if you don't have this access to any kind of technology, let it be communication or collaborative work with colleagues, then it can, we can see that it has very serious consequences. What are your thoughts on this, Maryam?
Yeah, I agree with everything you've said, and especially around that domino or knock-on effect that one thing can have on everything else, because we have been relying on technology more and more even before COVID, and with the COVID, especially we couldn't go out, and all the sort of connections that we had with people were almost everything was moved to digital world, and we realized that a lot of the technology, especially to do with work and education, were inaccessible. So there has been some research coming out in some of the ACM papers that have looked at collaborative working in online environment using Google Docs and Word Docs, and how sort of that contribution of visually impaired people, blind and partially sighted people, can be actually minimized, and because the technology is not accessible. So despite having the expertise and the knowledge of their domain and their job, they are experiencing an unnecessary barrier, due to the inaccessibility of the technology. And Daniel, you and I have been going back and forth with documents, and we've talked about documents having 140 changes or something like that, and having to go through them linearly. So what has your experience been, particularly around work, since you've started during the pandemic, working at GDI Hub?
Yeah, let me come to the GDI Hub in a second, but kind of on the beginning of pandemic and some of my other experiences. So this concept of not really being in person in the office and have this physical proximity from colleagues is really difficult for, I think, for screen reader user people and blind people, because very often, to some extent, a service that the company is using can be accessible, but sometimes you just need to find little hacks around it. So I remember this one case when I was meant to do an internship. It was meant to be a 3 months internship in a company to do some research, and I did it for the first 2 weeks. It went really well. Then I had to come home, continue from working from home, and at that point we also had to start using this very tiny application for like tracking your time and kind of logging your time. And because it wasn't really a mainstream app, it wasn't 100% accessible. and I needed to figure out. So we tried to do that, through like a call online. But the problem is, like, they only hear and see what the screen reader reads out. They can't really just sit next to me and give me hints like, okay, maybe the screen reader wasn't reading out this button, or it was just reading, an unlabeled icon. But this is what it says, and then I can, find ways around to access the menu or the feature I need based on that information. But when you don't have anybody sitting next to you looking at the screen, then that becomes very difficult. Yeah, and in the GDI Hub, now I feel like we have a little bit more experience with how to work from home, and luckily everybody was very, very welcoming. So the last 5 weeks just really felt great. And even though it's been only a few weeks, I feel like I've been working with a team for many months, and I think the dynamics in the team is really great. But sometimes we run into this thing that even though we work for and are really ambitious and passionate about disability inclusion and assistive technology, I feel you really have to have this inclusive kind of mindset and ecosystem in the team. So as far as I know, that there hasn't really been a blind or a partially sighted colleague within GDI Hub, and we are slowly finding out that some of our internal processes could be improved in terms of accessibility. So I see a great effort within the team to hammer out these little glitches, and I feel it's a really good collaborative process. We are learning from each other. I'm learning some things, how 20 people get edited one single document in a day and have like 400 revisions, which can potentially crash the screen reader because it's just way too many things to process for it. But then I feel some of the team members can learn from the way I feel comfortable working and most productive, so to speak. Does it make sense?
Yeah, absolutely, absolutely, and I think it's great to know for me personally, but also our viewers and listeners, as part of you know even though so we can talk about disability inclusion and everything, but the thing that you said about having that mindset of inclusion and making sure that our technologies we're using, but also our practices and our processes are also accessible and inclusive of people's different needs. So I think that's something that we are discovering. You're right. As we are working together, and we realized that some of the tools internally that we were using, were not accessible.
Yeah.
So yeah.
Yeah, if I may just add one comment there, because I think it's really important, and sometimes people again get a bit sensitive about it. So our job in the GDI Hub and the whole community of innovators and policymakers in terms of like inclusion, disability innovation is really to think globally to make sure that thousands or hundreds of thousands of people have access to hearing aids, and we get into the corners of the world where we haven't really been before, and that's a lot more important, and it's almost a bigger priority than, for example, having a 100% accessible website. It's better to have a 95% 95% accessible website than 100% one, just because that extra 5% might be something that requires years of research and development and potentially tens of thousands of pounds of resources just to make a particular, I don't know, a map accessible. But it may not be necessary for the greater good. So I think it's common that even though, for example, the web accessibility guidelines, have these two, I think, 3 tiers, like an A, AA, and AAA kind of system. And AAA is, obviously the best and the most perfectionist, but actually most companies and organizations, and even as far as I know, the legal requirements are only for a AA standard, because that's often good enough, and sometimes it's there's no point of us just kind of losing sight of the greater picture.
Yeah, I agree with that completely, and I think you're absolutely right that we can nitpick a lot of things, but at the same time, it's about the bigger picture. It's about providing, assistive technologies where they're needed. And, a lot of the GDI Hub work as part of our 2030 program has been driving towards that. And, we've done a lot of research into mapping the assistive technology needs and provisions around, different countries in the global south. So I think that that's definitely, more important, as you said. But I feel that there is also, more about advocacy and engaging in conversations about, what disability inclusion or, digital inclusion even means. And it's not just, as you said, it's not just about having accessible technologies. We need accessible minds, inclusive mindsets, and we need to make sure that, we put people in the positions where they can lead those conversations and awareness about disability. So this is kind of very, sort of a nice segue into my next question. So, as we're moving forward, we're responding and we're recovering from COVID-19 as a global community. So how do we ensure better inclusion and participation of people with disabilities in research and innovation and also leadership as well? What do you think?
Well, I think we definitely need to take advantage of this situation of, researchers being and leaders being forced into this new working style. And to some extent, like some researchers already were quite used to online working simply because academic collaboration happens very, very internationally. So just one of my latest personal example, working with a group at MIT. So there's no way, even if there wasn't a pandemic, that we met very often, and generally that's fine. So on one hand, we need to continue that. But for some people who were more used to in-person research, they can now see how to separate the workflow into a hybrid process, where it's more efficient to do it online, where it's less efficient, do it separately. But one other great thing that, research with people with disabilities is always a little bit more challenging than working with the, so to speak, general public, although it's a very tricky phrase, simply because, you have to make sure that you have all the accommodations in place, which can be sometimes very difficult to work out. And online way of doing research is a great way to overcome this.
Yeah, definitely. I think from personal experience of conducting research online over the last couple of years, I feel that there is it's a two-edged sword in a way that, it can be, working online can be a great equalizer to have, to involve and include participants with disabilities in research, because, people who are unable to travel, they can participate remotely, in interviews, in any other remote studies. But at the same time, researchers, as with anyone else, we have experienced that sort of barrier of not having direct access, and studies that or research that requires physical access to participants in labs and experiments. So that has been obviously something that we have had to overcome and develop new strategies as we as with time. And new methods that we're seeing some good research coming out of different venues, and you and I have been working on something together on that as well, hopefully to publish next year. So I think it's again, going back to your point about looking at the broader picture, right? So what do you think, having learned what we know now from the impact or I guess inequality around service provision or inaccessible technologies, especially because of COVID, we've sort of had COVID has amplified that knowledge that people knew. Yes, definitely we need to improve the processes, we need to improve people's thinking, create awareness, improve technologies. So how do we change our research and innovation process so that we can have more disabled people coming to us, participating in our research, but also leading innovation and design? How do we go about it? What do you think as your role as an innovation manager at GDI Hub and your experience? How can we move forward in a better way, in a more inclusive way?
Yeah, I don't know if that's necessarily, the result of the pandemic. It might or it might not be, but I definitely believe that, this idea of working with and not working for disabled people is a good trend. And I think I've seen, some of that already. It has been talked about before the pandemic. So I think it was already kind of in the atmosphere to have this change. And I think maybe the pandemic just accelerated this because, as you said, like online communications opened it up for people who couldn't attend in person before. And the researchers recognize this is a good opportunity. Then, like, basically now we can go to them. And I think that's really the most important. I'm not saying like every single research has to have a disabled person in the team just because it's good to have one. They need to still have the relevant kind of experience and added value in the team, because otherwise it just becomes like a showcase. Like, look, we have this person in the team, great, be happy. But that's not really what we want. So depending on your needs, if you do a project X with your research, you really need to find somebody who is potentially a colleague, a researcher in that field with a disability that is relevant to that project. Or if not, then well, it's a little bit more difficult. But you need to do networking. You need to reach out to some of the disabled people's organizations and like GDI Hub to find somebody who has the relevant interest and experience and the lived experience as well, not just the sort of skill or academic experience, and then have them as a full collaborator, not just to review and have 1 or 2 hours of discussion, but if it's a 6 months project with weekly meetings, then have that person from the beginning all the way to the closing date of the project every week, and have them contribute in that way. And I think that's what we'll need to promote for more and more.
Definitely. Yeah, I completely agree with that. And we are becoming more cognizant of this, and moving forward, all of our research, we are making sure that we are putting disabled people at the heart of innovation and design work, and we're including them as experts. Sorry. In our research and design process. Personally, I have learned a great deal from my participants that I sort of work as consultants on my research now, because it's so important. I can only having some personal experience of caring for and living with sight loss. I think that I can only understand from and understand from someone's experience. Not having a lived experience of it, I can never know what it's like to have a particular disability. So it's absolutely crucial to have people involved as experts, as designers in our innovation and design processes. So yeah.
No, if I can just add to that, and although it's very important, I think this is the way to go forward. It's also something we still have to be mindful of. Like, there's nothing in this world that it doesn't come with pros and cons. There's cons to this approach as well, and mainly that even if you're very lucky and you're really good at identifying who would be a really good collaborator with a disability experience on the team, you still have to make sure that you don't stop that. You don't just say like, okay, this research has been done in code, using a co-design method, therefore it's great. It's just as important to still validate whatever you worked on through traditional user studies tested by disabled people, or the audience of that particular research. So it's not, I don't feel this is exclusive of each other. It's just that previously people were more focusing like, okay, here's the idea, we develop everything, and we just run a user study with, you know, X number of disabled participants. I think now it's becoming more of a two-step system where we do our thinking and development of the research idea, including, you know, 1 or 2 disabled people, and then we run a user study with, you know, 20, 30 other participants. Because regardless how good you identified the team member you need on the team, they'll come with their personal experiences, their personal biases, and that's not something we can afford in objective research. We need to have a mechanism to filter out that subjectivity.
Yeah, absolutely. Completely agree with that. So I think we're going to close the conversation at this point. Daniel, do you have any last points, any advice that you would like to give to researchers probably listening to this talk?
Oh, no. I very much step back from advising people. I'm happy to share my experiences, but, you know, I'm more keen on hearing other people's advice. So, you know, if anybody who listens to this, please do feel free to reach out to the GDI Hub team or to Maryam or myself, and we'll be more than happy to, you know, take up on critiques and positive feedback as well.
Absolutely. I just realized that we didn't describe our background only because Daniel and I were talking about it just before I started the recording of this webinar, talk. So just for the uninitiated who don't know the UCL building, and for our screen reader users, the background shows some really nice trees. It's a view from the main quad of the UCL building in London, where you can see the iconic UCL front and the dome. And on the left-hand side, on the top, is the Disability Innovation Hub logo. So I apologize for that, but it's a really nice background, and Daniel really likes it as well.
Exactly, I love it. And for those people who had some meetings with me in the past, they know that my background was like an outer space kind of, you know, Earth view, and I was usually calling from the International Space Station. And I'm delighted to announce that I have returned to Earth.
You have indeed, but I really like that one as well. It really looked like we were talking to you in space. As I was saying, that your camera is positioned really nicely on your the way you're on your desk. Okay, so thank you, Daniel, for sharing your thoughts and an insightful and exciting conversation. Thank you, everyone who's been listening and watching. If you have any questions or comments, do reach out to us via our website. We have some contact us forms that you can use. You can find our contact details online as well, or you can reach out to GDI Hub social media, particularly on Twitter, using the hashtag IDPD2021. Thank you, everyone. Bye.
Thank you. Bye.